Thank you, Dr. Tate. I'm really pleased to be here today. My name is Dr. Christina Lengyel from the Faculty of Human Ecology, Department of Human Nutritional Sciences. And what links me to the Manitoba follow-up study is really looking at nutritional well-being, longevity, and quality of life of older adults. So how did I get started here? Well, I started my tenure track position in January of 2005. And you're always encouraged to network, especially when you're coming from a different university. So when I came here, I attended a Lunch and Learn seminar on aging at the University of Manitoba, sponsored by Research Services. And that's where I had the pleasure of being introduced to Dr. Tate. And I already knew a little bit about the Manitoba follow-up study, but this is where I learned more about it and got really excited that they already started to do some nutrition data collection. So just a little brief history of this. So what we had started was, they had started a nutrition component to the Successful Aging Questionnaire, the SAQs. And it was started in 2000. We started to analyze that, and then there was subsequent nutrition components added to 2005 and 2010 SAQs. From there, we started to do analysis, and then there's always questions that come into mind about where else we can go, and there was many, but we wanted to know, so we knew about their food consumption patterns and comparing frequency of consumption to also looking at the Canada's Food Guide. But what we didn't know is whether these men were at risk for malnutrition or poor nutritional intake, which leads to subsequent mortality, morbidity, and of course poor quality of life. So what we introduced starting in 2007 was looking at nutritional screening. So we developed a questionnaire, and it included a component on nutritional screening. It is a validated tool called Screen2, developed by Dr. Heather Keller from the University of Waterloo. And then we also added components of self-rated diet, self-rated health, of course successful aging. And this actually has been going on since 2007 with our 6th wave. We're sending it out next month. So what are some of the accomplishments of our research? There has been many since 2005 in terms of nutrition. We have 3 publications in peer-reviewed journals, working on a manuscript, and many more actually that we're thinking of. We also trained undergraduate students, 2 senior thesis students from my department, and 2 of the publications are also from them. Currently, we're partnered up with WRHA, with the MPP program, which is the Manitoba Partnership Internship Program, where students are trained to become registered dietitians. And the student is working with us to satisfy her nutrition component, and she is also working on a component of this research. We have numerous presentations, local, national, international, of course, different varieties, poster oral and invited. So here are kind of a snapshot of some of the things that we have discovered. And the first line and the last 2 are their published manuscripts and also presentations in Italy last year, Washington, D.C., San Francisco, and others locally and nationally. And also we are working on a nutritional risk publication, which we presented in Atlanta at the GSA conference. So funding. We received two sources of funding for this, the Thorlaxon Foundation Fund just this year, and also I received the Center on Aging Research Fellowship, so really thanks to these funding organizations. So what are some outcomes of collaboration? And there are so many, I couldn't list them all, but this is a wonderful group to work with, such rich data and very knowledgeable expertise. So for me, especially a new faculty member, the exposure and experience with longitudinal research is wonderful. I haven't had that experience before. Developing my own longitudinal piece from the Manitoba follow-up study looking at nutritional risk, and also expanding my research focus to include older men residing in the community. And my research expands. I look at older adults in personal care homes in the community, rural and urban. But the one thing about research with older adults is you usually have participation from women. They live longer than men, and also they're more likely to participate. So in this case, we have a whole cohort of men that are intrigued by the study, who participate, and who are very excited about answering these questions, these surveys. So I'm very, very fortunate to be able to do this. And also it's a very important area because men are living longer, and they are living, they're living longer in the community as well. Oh, and the other thing I have to add is, because of working with Manitoba Follow-Up Study, I've learned to apply different statistical approaches, which was really important. So future research with the Manitoba Follow-Up Study, we are continuing our longitudinal research on nutritional risk, so the 6th wave, sending out next month. We're examining resiliency in nutritional risk, so looking at whether men do improve. So if we look at nutritional risk or screening for it 5 years ago, do they improve or do they decline? What factors impact this? And so we're currently examining that. Also looking at survival rates and cause of death, because we have all that information because of the Manitoba Follow-Up Study in relation to dietary consumption patterns, nutritional risk, and successful aging. Okay, so next up, thank you very much.